Hello everyone, good evening. My name is Kavita and today we will discuss about OET listening part A, where we will discuss about the fact how we can make a good judgment of answers and how we can make a guess, making a guessing technique. For that we need to utilize our 30 seconds which will be given prior to our section, like from 1 to 12 we will get 30 to 40 seconds, I guess 30 seconds. So these 30 seconds are very crucial and today we will learn how to utilize those 30 seconds. Okay, so firstly we need to understand the scenario here, which topic is being discussed here between the doctor and the patient, so that we can carry forward our thinking or judgment toward that particular disease condition or scenarios, because we are nurses, we are doctors. um, so we know the situation, we know the disease condition and the complications because of that disease and the symptom and signs. So we know exactly what happens when the particular disease condition is there, but we need to make a correct and good judgment about that in listening. So sometime we make a good judgment about the answer and it turns out to be a correct answer. So few answers we need to listen carefully and few answers we can priorly we can make a guess. Okay, so firstly we need to understand how we can utilize those 30 seconds. Firstly, so we need to understand the patient is Mr. Thompson, and firstly, okay, the first thing first, you need to understand about your headings so that you can get a idea from where you need to pick an answer, from the patient side or the doctor side. Okay, so presenting complaints itself saying that these are the answers which will be coming from the patient. Okay, because he is telling the presenting complaints to the doctor. Okay, so let's read below toward the first line. First episode of chest discomfort noticed about. Okay, so about dash back. Okay, just a second. About dash back. So this about is giving us a major hint about what? About the time. Okay, so I don't know what is happening there. Okay, just give me a second. Okay, yes, it's correct. Okay, so we need to understand about the word about. Okay, so first episode of chest discomfort noticed about dash back. Dash back means maybe he is telling about the time period where he started having discomfort in chest, about 3 months back, about 2 days back, about 1 day back, about last week, right? So he's 10 days back, maybe the more chances are of days or months. Okay, the 3 months back, 10 days back. uh, so yes, you need to focus on timing here, maybe months or days. Okay, next, dash mistaken for digestive upset, pain or symptom mistaken for digestive upset. Whenever we have an chest discomfort, we always, our instinct think of gastritis or acidity. Okay, so here the patient is also saying this thing, that maybe he is talking about the pain, maybe he is talking about the discomfort, maybe he is talking about the initial period, initially mistaken for digestive upset, pain mistaken for digestive upset, discomfort mistaken for digestive upset. So try to think about the words which can be fitted in the blanks. Okay, so this can be here. And next line, experiences a chest tightness which sometimes sharpens and extended to the dash. Extended is what? Extended is the another name for radiating pain. You need to learn about the synonyms of pain, what kind of pain it is: sharp pain, dull pain, shooting pain, knobbing pain. Okay, or there are many types of pain. You need to learn or mug up those words, okay, before going to your exam. So extend to the dash. Extend to what? Arm, shoulder, jaw, or what? Any body part he is talking about. Okay, so firstly he experiences chest discomfort, then chest tightness which sometimes sharpens and extend to or radiates to the arm, left arm, or shoulders or jaw. Okay, these all are the symptoms of angina. So we automatically think about that and the symptoms comes into our mind. Discomfort episode spans dash. Okay, occasionally accompanied by dash and episodes of cold sweating. Accompanied means together with dash complaints. Accompanied means when he is talking about chest tightness, sharpness of pain, and radiating pain, occasionally it comes together with, occasionally accompanied by tiredness, or I don't know, but maybe a symptom. Okay, and episode of cold sweating, breathlessness, maybe tiredness, maybe it could be anything but a symptom. You need to focus on a symptom when you are listening. Okay, discomfort subsides upon a short period of time. Short period of time, it is exactly what comes in my mind, that it could be a time. Discomfort subsides means reduces, decreases upon a short period of time. And next, the medical background is also the patient is telling, so the answers comes from patient side. His father experiences dash in his late 60s. So he is talking about some disease condition, maybe the heart attack, maybe some other disease condition, but it is 110% surety that he is talking about some disease condition which his father experienced in his late 60s. Okay, next, had dash done a couple of years prior. He is talking about some, maybe he is talking about some procedure, had done procedure or therapy or a session, it could be anything, but he has done something a couple of years priors, maybe a test. Okay, it could be anything. So you need to focus on procedure, procedure and investigation. It could be a lab investigation, it could be radiology. Okay, results were okay. So it is confirmed that he is talking about some investigations, not a procedure, because he is talking about results. So if we have lab investigation or radiology investigation, then only we can talk about results. During the procedure we can only talk about the investigation is biopsy, but the condition is not suggesting about biopsy, so we will think about ECG, echo, and maybe angio. Okay, it could be anything. So results were normal or results were not up to mark. It could be anything. So you need to focus on results, which will be normal or not normal. Physician's observation. Now your answer will come from the physician side. Okay, possible dash. Possible what it could be? Possible dash or other cardiac issues based on symptoms and hereditary factors. Now physician is telling him that it could be dash or other cardiac issues. So he is talking about some disease condition. So you need to focus on disease condition. And next, suggested diagnostic procedure. So he is telling him to do some diagnostic procedure. So you need to focus on diagnostic procedure or test. Initiate dash scan. What scan? Ultrasound scan, MRI scan. Probably he will talk about echo, ECG, or ultrasound, or renal or angiography, but it will not include the scan word. So we will not go that far, but scan is something, maybe abdominal ultrasound scan to rule out his gastritis issue or something else, whatever the doctor wants to rule out. But you need to focus on the radiology side because he is talking about scan. Dash, if necessary, dash to observe cardiac function. If necessary, dash to observe cardiac functions during physical activity. If it is necessary, if your condition is not cured or if your condition is not improved, maybe we need to observe dash functions during physical activity. Then TMT comes in my mind. Okay, stress echo comes in my mind. Dopamine induced echo or TMT comes in my mind because he is telling about the physical activity. During the physical activity, he will observe the cardiac function. So as a nurse or as a doctor, you know about the test which is done under these conditions or during the physical activity. Okay, so these are the basic things which you can practice while you are doing listening, and there are more hints and tips and tricks, but the video will be so long, so I'll not waste your time. So try to focus these things, and also try to focus on your fill-ups where it is situated. Okay, when your fill-up is initial, so you need to write your letter in a capital first letter, and when it is in between the line, you need to write as it is in a small letters. Okay, so as a English rule, we all know that, but when we are in pressure during the exam, we forget that. But try to practice this thing. And also articles plays important role. We will discuss in any other video. If you like this video, please let me know. You guys do not do comments on what you want, what kind of video you need. Until then, maybe I will not get what you want. Okay, so if you want other video regarding your listening or any other module, please do comment and subscribe my channel. I will definitely make a video and post it. Okay, so next I have uploaded the two sections or one full listening part A, and in the end of the video there are answers, so you can match your answers with your guessing techniques. Okay, and do comment your scores so that I can understand how successful I was to make you understand the tips and tricks, mostly about the guessing technique. Okay, so have a look.
Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes. Mr. Thompson, it's a pleasure to meet you. I've received your referral from your GP regarding your recent episodes of chest discomfort. Can you explain a bit more about what you've been experiencing?
Yes, doctor. About a month ago, I started feeling this heaviness in my chest. Initially, I brushed it off thinking it was just some indigestion, but over the weeks, it's become more frequent. Sometimes it feels like a sharp pain that radiates down my left arm.
That must have been concerning. How long do these episodes last?
They usually last for about 10 to 15 minutes, but it feels much longer when it's happening. I've also noticed that they tend to come on when I'm walking briskly or climbing stairs.
Have you noticed any other symptoms with these episodes? Maybe shortness of breath, sweating, or dizziness?
Actually, yes. I sometimes feel a bit breathless and have broken into a cold sweat once or twice.
I see. Does anything help alleviate the pain? For instance, taking a rest?
Yes, when I sit down and rest for a few minutes, the pain usually goes away.
And have you had any similar issues in the past or any family history of heart problems?
My father had a heart attack when he was in his 60s, and I've had high blood pressure for a few years now, which I take medication for.
It's good to know. Based on what you've described, I'm concerned about the possibility of angina or other cardiac issues. We'll need to run some tests to get a clearer picture. Have you had any ECGs or heart-related tests recently?
Not recently, but I had an ECG a couple of years ago, and they said it was normal then.
All right. We'll start with an ECG and possibly a stress test to see how your heart behaves under exertion. It's essential to get a detailed evaluation given your symptoms and family history.
I appreciate your thoroughness, doctor. I've been quite worried.
I understand, Mr. Thompson. We'll work together to figure out what's going on and ensure you get the best care possible.
Mr. Thompson, that's me. Hello, Mr. Thompson. I'm Dr. Sanders, the dermatologist. What brings you in today?
Hi, Dr. Sanders. Over the last month or so, I've noticed these red, itchy patches appearing on my arms and legs. They sometimes get dry and flaky.
I'm sorry to hear that. How often do they itch?
Almost every day, especially at night. It's really disturbing my sleep.
Have you tried any over-the-counter treatments or creams?
Yes, I've tried a couple of moisturizers and an anti-itch cream, but they only provide temporary relief.
Have you made any changes in your skincare routine, laundry detergent, or diet recently?
No, everything's pretty much the same. Although I did start swimming at the local pool more often, about the same time these patches began.
It could be related. Sometimes excessive exposure to chlorine can cause skin reactions. How often do you swim?
About 3 to 4 times a week.
I see. Do you shower immediately after swimming?
Not always. Sometimes I just change and head home.
It's essential to wash off chlorine and other pool chemicals after swimming. They can be quite harsh on the skin. I recommend taking a shower right after your swim session. I'll also prescribe a cream to help with the itching and inflammation. If you don't see any improvement within 2 weeks, come back and we'll run some tests to rule out other conditions.
Thank you, Dr. Sanders. I'll follow your advice and hope this clears up soon.
You're welcome. Take care, Mr. Thompson.